My name is Josfrida Nyamvula Ngoa, an emergency and critical care clinician and a COVID-19 champion. We have talked a lot about physical health. For example, how to prevent and treat COVID-19. In this module, we turn to mental health and psychosocial support. The WHO defines mental health as a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. Multiple social, psychological, and biological factors determine the level of mental health of a person at any point in time. Risks to mental health include socio-economic pressures, stressful work conditions, gender discrimination, social exclusion, unhealthy lifestyle, and physical ill health, just to name a few. Mental health can be promoted through psychosocial support. Support that people receive to protect or promote their mental health and psychosocial well-being. It includes support for people's general psychosocial well-being, helping people connect with other family and community members, helping them deal more effectively with personal challenges or practical problems. Treatment and prevention of psychiatric disorders such as depression, anxiety, and post-traumatic stress disorder, PTSD. The COVID-19 pandemic has created fear and anxiety, affecting adults and children, including healthcare professionals. Stress can be due to various factors: fear of getting infected and spreading infection to the family members, fear of being harassed by the public, fear of not getting adequate support from the administration, that is the organization or government, fear of losing job, that may be due to long days of quarantine, fatigue and burnout from working for long hours and being subjected to human suffering, being away from family and friends. These stresses negatively affect mental health and necessitate psychosocial support. None of this is easy, but to continue doing your work, it is very important to take care of your mental well-being. Stress is not a disease, but if not recognized and is underestimated, it can cause mental and physical health problems. While this can be scary and can hinder your work, you are not alone. It is quite normal to feel this way in the current situation. It is important to acknowledge the fact. The Government of Kenya and Ministry of Health, MOH, has recognized mental health during the pandemic and has guidelines on how best to mitigate mental health challenges during this time. In line with this, it is imperative this module is designed to guide healthcare workers and their patients on the best ways to cope with COVID-19 mental issues. At the end of this module, you should be able to describe the causes of stress caused by the COVID-19 crisis, articulate the importance of practicing stress management during COVID-19, articulate the importance of practicing self-care while continuing to deal with COVID-19, understand the importance of empathy when delivering bad news related to COVID-19, understand the psychological and social risk of post-traumatic stress.